So the eye movements are also a distancing interrupting factor, along with the breaks, the check-ins. And so we've got kind of these different elements here that are interrupting cognitive processing, emotional processing, far more frequently than something like prolonged exposure, where check-ins are shorter and fewer, farther in between.
In this video with Jeremy Fox, we talk about the Zeigarnik effect, or Zeigarnik effect, or Zeigarnik effect. We were not really sure. Jeremy published a fascinating article in the Journal of EMDR Practice and Research. And in this article, he describes a new mechanism of action for EMDR, the Zeigarnik effect, which is a memory bias toward completion of interrupted behaviors. From the perspective of the adaptive information processing model, the Zeigarnik effect explains why people suffer symptoms like rumination, intrusive thoughts, flashbacks, and nightmares. And it also explains why EMDR is so effective. In this interview, Jeremy explains the Zeigarnik effect in detail and also provides a demo of the two-handed interweave toward the end of our conversation. Here's the interview with Jeremy Fox. Jeremy Fox, welcome to the Art and Science of EMDR, and thanks so much for being here.
Thanks, Rodom. It's an honor to be here. I'm excited for our conversation today.
Yeah, Jeremy, so I invited you to talk about this article that you published in the Journal of EMDR Practice and Research last year. And the title of the article is Recovery Interrupted, the Zeigarnik Effect in EMDR Therapy and the Adaptive Information Processing Model. So interesting name. And I guess the first question is, what is the Zeigarnik effect?
Absolutely. We'll get into that. And yeah, the name is quite a mouthful, isn't it? But you can just call it Recovery Interrupted. That's why I wanted something catchy for the initial two words, because I mean, people will be interested in what it is. So the Zeigarnik effect is a property of memory that was discovered back in 1927, so nearly 100 years ago, by a psychologist named Bluma Zeigarnik, okay? So she noticed that interrupted tasks are better remembered than completed ones. So she noticed in a restaurant that wait staff could more easily remember orders that were open, that they had to complete, right? Versus things that they'd already fulfilled. So she went on to research that and noticed that interruption of tasks, okay, results in increased likelihood of recalling that open task, okay? And replications of her initial research have been pretty robust. So we know that individuals tend to cognitively and emotionally dwell and linger more on tasks that are unfinished, that are open, and that drive for closure.
Right. So for example, if I finish my work day and I have 12 tasks that I didn't finish, that would explain why I keep thinking about them. That's in the context of everyday life, right? Not before we even get into trauma. I think this is why it's probably not a good idea to check our email 2 minutes before we start a session with a client, right?
Right. I mean, it detracts from your attention, from your flow state. I mean, it's been posited that the Zeigarnik effect is really a motivational component of rumination. And so in our world today, with so many distractions, if we're trying to hone our discipline and our motivation, then we want to recognize that when we notice something that we need to do, if it's not essential right then at that moment, it may start our gears turning, so to speak, and make us want to pursue that. So that's a good example.
Right. It literally, what it does, it takes cognitive resources, right?
Mhm.
So that's everyday life. What are the implications of the Zeigarnik effect when it comes to the AIP model, the adaptive information processing model of EMDR?
Absolutely. So I draw a lot on Peter Levine's work. That was really what lended a lot of logical underpinnings to my article. So for anyone who knows Peter Levine or doesn't, he conceptualizes trauma as interrupted survival actions, thwarted. So you're trapped potentially and unsafe, right? That's how he conceptualizes trauma, is those two crucial ingredients of being immobilized and being unsafe. If you think about it, if you're unsafe but mobile, you can move, then you escape. And we know that the incidence of PTSD in people who were able to escape and avoid a situation that otherwise might have been traumatizing is lower because their bodies served them. Their fight or flight response kicked into action when it should. And then on the other hand, we know that if someone's confined in a space, but it's their choice to be there, right? Then they're less likely to have trauma as well. So those two ingredients are very key of immobilization and danger. Okay. So Levine talks about interrupted survival actions that result in vivid procedural memories. So those memories that come up wanting to do something, right? And they recur as traumatic intrusions, those active reliving symptoms of PTSD or even subclinical trauma when we go back to something where we felt vulnerable or trapped. So I explain this as an instance of the Zeigarnik effect, and I just provide an overview of that in the article. So really my contribution here is that interruptions are a key element of EMDR. It kind of leverages that. But if someone, let's say someone lacks closure and that they felt taken advantage of in some way, and they go back to wanting some closure, that wishing that event had turned out differently, okay, that's going to be an application of that to trauma, the Zeigarnik effect, which again, it's that motivational component of rumination, the wanting to do something, that desire. So I kind of use rumination synonymously with the Zeigarnik effect. And it's really prompted by that autonomic nervous system activation. We know heart rate being activated from a cue environmental trigger, or in other words, something in your environment that reminds you of an incomplete task or incomplete escape for trauma, sets off that reminder and that drive to completion, which in the article is another way that I refer to the Zeigarnik effect.
Yeah. What I found interesting, so you talk about rumination, but then when it comes to trauma, we have even more severe, you can say, take rumination to the next level, which is intrusions. And then trauma doesn't have a cohesive kind of beginning, middle, and end, but it comes in fragments of memory. And one of the interesting things I found in the article is what you describe as a feeling of knowing. What is feeling of knowing?
Sure. So that's a concept that I dug deeper into in my lit review. I went down the rabbit hole. So it's simply a judgment that precedes a prospective memory retrieval. So it's a funny term for it, epistemic feeling. Okay, like it's a feeling, in other words, that connects to a sense of knowing, which is that kind of epistemology or search for truth. So it's positively correlated with an increased heart rate in response to familiar cues. Okay, so let me give an example, kind of how it breaks down. So psychological stress in your environment, okay, something that reminds you something, can increase a cue reminder, right? Again, we talk about those triggers. We talk about that a lot in EMDR. For everyone out there, I'm talking about an environmental trigger, okay? It increases heart rate, and that results in a feeling of knowing judgment if your brain recognizes that as a familiar situation. And so we know that those feelings of knowing through research, and I've got receipts for that. You can look at my references in my article.
I did, yeah. Yeah.
So that increased the environmental trigger, increased heart rate, then feeling of knowing, and a search for that memory. And this is unconscious stuff. You're not logically thinking, I'm searching for a memory. But in trauma situations, the feeling of knowing and then the prospective memory search is like you come up with that timeless traumatic memory that hits that you need to flee, right? You need to complete that. And you might be in a theater and you hear a loud sound in the movie. So your heart rate goes up because you had that cue, that noise, then the heart rate prospective memory search, oh, I need to get up and be careful. This is an incomplete action, because traumatic memories are timeless and they're framed in that perspective way of I need to act on it rather than this is in the past and it's over, which is what EMDR helps someone to read.
Okay, so let's talk about EMDR from the perspective of the Zeigarnik effect, and how do we understand EMDR and how it works or why it works from that perspective?
Great. So I'm going to go all the way back to the beginning of EMDR, as our listeners will recognize, with, of course, Francine Shapiro. So she actually, in her 2001 book, the protocol book, suggested that interrupted exposure, and that's a quote, that term, interrupted exposure, of short dual attention stimulation sets, okay, alternated with check-ins, are the essential ingredients of EMDR. So you've got the exposure, as we know from the client dialing up the memory with the elements of the protocol. And then, okay, that's the exposure for however many sets or seconds. And then that check-in, right? Interruption, processing, and check-in, interruption, synonymous there. So the EMDR model functions via that continued switching between a memory exposure to the memory, and then therapist interaction and orientation of the present, interruption. So this distancing process, which is a focus upon material other than the traumatic memory, right, such as therapist verbal feedback or even the eye movements I get into, is associated with greater symptom improvement than exposure alone. Again, this is backed up by research. So check-ins can also limit client avoidance of memories, because we're increasing their desire to resume processing when we make that processing incomplete even more by saying, okay, come back to the present. What are you noticing? I've had clients be like, oh, I really want to go back into that. Well, that's what we want, right? Because if clients have an avoidant tendency, which of course, why wouldn't they with traumatic memories? They're frightening. We're kind of leveraging the Zeigarnik effect to say, okay, I'm pulling you out now, okay, and you can go back in, but we're inducing that interruption, and it causes clients often to recognize, wait a minute, I'm doing fine in this memory, let's go back. So we're leveraging that drive to completion, okay, again, which I'm using the Zeigarnik effect, drive to completion, however you want to refer to it. So we're accentuating that even more with EMDR than what's there. And we're using that as a way to dial up. Remember when I talked about feeling of knowing? Well, when we have clients imagine the traumatic event and that heart rate goes up, right? Because you have to feel it to heal it. That's a big motto in EMDR, a big rhyme. Okay, we're dialing up that trigger in the form of the protocol. Heart rate goes up, their brain connects. They may have that desire, okay, I want to go through and complete this. And we're interrupting a little bit more and stoking that fire of completion even more. And so Jim Knipe is his work is a great example of this with the CIPOS, the constant installation of present orientation safety, again, CIPOS. So he uses very titrated or shortened processing. He'll have someone notice their calm place with eye movements, and then a few seconds of a traumatic memory, and then the calm place again. And so starting out with that, if people are extremely avoidant of the memory, again, totally understandable, can stoke that drive to completion. So if anyone wants a real good way of conceptualizing what I'm talking about, then the CIPOS protocol modification that Jim Knipe does is a prime territory for that, because it's using interruptions. We often think about EMDR in terms of the eye reprocessing, the eye movements, but the breaks in it are just as crucial. And so the eye movements are also a distancing interrupting factor along with the breaks, the check-ins. And so we've got kind of these different elements here that are interrupting cognitive processing, emotional processing far more frequently than something like prolonged exposure, where check-ins are shorter and farther in between.
Right. Yeah, that makes a lot of sense. And that, I guess the Zeigarnik effect is its own explanation of why EMDR works, right? Like it kind of like almost another mechanism of action. But yet, Jeremy, sometimes the processing gets blocked, right? So sometimes, despite of, doing a lot of short sets,
Mhm.
processing gets blocked. So first question is why? Why does processing get blocked?
Well, there's a few different reasons why that could be. One of the most common is that people have a phobic avoidance of reprocessing the trauma. And so in that case, we have to almost do some flooding that for someone who accesses or over accesses the memory, meaning has more reliving symptoms, that would overwhelm them, but not for a client that avoids. And again, every case is different. So we've got to be trained in this stuff as EMDR clinicians, is we want to be very contextual and appropriate depending on the client. Everything is tailored to them. So in that case, interruptions are probably going to be a little less helpful, because, right? Well, you know what? Let me rewind that. So if they're having trouble connecting, is what I mean, then we're going to want to go deeper, and we're going to want to have the memories be vivid. Um, if they're able to connect but instantly block it out due to the fact that there's some fear there, then the Zeigarnik effect will come in very handy, because what we do with that is we say, okay, understand that you're fearful of memory. Again, the CIPOS method, CIPOS from Jim Knipe. If someone's blocked and they're really afraid of it, we have them focus on a fragment of the memory for a few seconds, and their brain recognizes, I can handle this. So we're within Dan Siegel's window of tolerance model. So for people that under access, they go into that hypoarousal, blunting out state of shut down that memory, quarantine it, put it away. And so when we show them that they can actually surmount that their brain can handle, and their emotions, their body can handle the memory, and we distract enough from it, there's that dual awareness. That's a crucial part of EMDR again. And what does that mean? Well, it means that we're distracting from the memory. We're interjecting the present into that past memory. So blockage can often come from someone feeling overwhelmed by the memory and shutting down. And in that case, we pull it back, and we interrupt more and leverage that Zeigarnik effect. If someone is just unable to access the memory for whatever reason, we do some more prep work if it's unrelated to feeling flooded by it and putting it away. But in cases, again, where someone is afraid to access it because they feel overwhelmed, well, we have resources for that, adaptations, and EMDR itself, the standard protocol, is very robust in providing those interruptions via eye movement and check-ins. As long as we're using those well, then clients should be able to avail themselves, that they should be able to feel safe. And that's a huge thing. Another way that blockage occurs is if someone isn't connecting with it and there isn't that immediacy. So with the Zeigarnik effect, we can say, okay, what caused you to feel, what blocked you from escaping, and what do you wish you could have done? That's a big thing I talk about in the article, is looking at thwarted escape attempts, and that being the emotional touchstone and the element. If someone's having a difficult time pulling up the emotions, which is a huge blocking factor, if someone's very intellectual, and that the emotions come up, but only in cases where they're not in our office and they can't do it on command, we can expedite that by having them look at that key moment of feeling trapped, right? And interrupt it.
Yeah, and we all know, or I shouldn't say we all, but we generally know that um, we have more block processing when people have complex trauma. Why is that?
Well, because there's years of avoidance built up there, and the need to continue functioning in spite of that. There's different ego states, which for anyone that's unfamiliar with that term, it means a conscious functioning state, essentially. So it's not an alter like in DID,
Mhm.
but it's a state of functioning that might have come from a younger place. Okay. So maybe you're acting out a kind of petulance or demanding quality of a teen version of yourself. And you remember doing this, you're like, what came over me? That phrase is often an indicator of that. So people can be operating from different states at different times and have a hard time shifting on command, which some good prep work and noticing those states and integrating them can be helpful. Shame is a huge component of complex PTSD. So if people feel like they deserved something, or they don't even view it as being trapped or something or anything like that, but it's all just what happened. And there's also a great deal of dissociation that can be present. So failure to really connect with the memory, like when it's activated, not going through and putting it back in history where it belongs, but reliving it and then losing access to that memory. All those things make it difficult and can kind of block processing.
Yeah, no, and one of the techniques that you share that you've been using and found helpful to deal with block processing when a client has block processing is the two-handed interweave. Can you say a few words about that, and maybe we'll do a little demo to show how it works?
Absolutely. So the two-handed interweave was created by Robin Shapiro. Okay, and I've got her book right here. She's a great luminary in the field. And so the way that it works is through much the same that the best things do in EMDR, combining the intellectual and the sensory. And so we have clients imagine anchoring a conflicting feeling, thought, choice, belief, or ego state even. So part of the personality in one hand. And then the other thing that's the other state or belief or whatever in the other hand. Okay. And we have them then commence eye movements or tapping or whatever bilateral dual attention stimulus we're using in that session. And we have them notice if there's distress in both or either of those choices. So it's cleared with the protocol. And we have the client also notice which hand calls out more for them to follow, kind of like a fork in the road exercise. And we have them notice, okay, what feels stronger now? What do you want to pursue?
Yeah. I wonder what should we do a little demo? I know that the two-handed interweave helps a lot when clients are ambivalent, right? Do you do it? Do you use it in addiction work?
Yes, I do use that for ambivalence. You know, that conflicting desire to let something go versus follow a new path. Absolutely, I use it a lot with clients who have difficulties making their own decisions because, as we were talking about earlier, with complex PTSD, there can kind of be a lack of awareness of one's own subjective desires. And so something like, well, what do you want to do with this given choice? Which hand do you notice calls out more for you to follow it? Let's go with that. It's very helpful for anything subjective like that, for strengthening personal preferences and just regaining and reconstructing that sense of self.
Yeah. Okay. Let's do a little demo then. I had a lot of ambivalence about reading your article. I like the idea. I like the concepts. I was, as I shared earlier, familiar with the Zeigarnik Effect, but I struggle with the academic writing, all these quotes and all that. So sure. Can we do a little demo of that?
Yeah, that's absolutely fine. So you would just hold in whichever hand you choose the sense of desire to read the article and dive in. And then in the other hand, the desire to avoid, or the negative, whatever the negative response is, sensorily or intellectually, both, to reading it. So you anchor one in each hand, okay, and just imagine that. And now I'll have you notice which hand you feel more like following, right?
So quick question about that before we
Sure.
start. Oh yeah, so you start bilateral stimulation. Okay, I close my eyes. So
well, you could also, what BLS form would you prefer? You can do, I mean, it gets tricky because, as people could imagine, if you're imagining holding something in your hands, but remotely, as we're doing now, you're supposed to tap, then you'll have to imagine, like, as you're tapping, one hand holds that, or you're tapping that one thing and the other is in the other. So that can be a little tricky. I mean, it's still manageable. But I would usually use eye movement or the buzzers, because as one vibrates, you feel that option. And then when the other one vibrates, you feel that option. So that's a helpful iteration of it.
Yeah, I wonder if I know Robin Shapiro teaches some workshops on the two-handed interweave, and I know I'm wondering if there are any adaptations to virtual work. Do you have any thoughts or ideas about that?
Yeah, I mean, I'll be blunt with you. I use eye movement. I've used the two-handed interweave virtually. That way people can imagine just holding those hands and feeling the options in them while their eyes are moving. And as we know, eye movement is one of the most well-researched forms of EMDR. I mean, it's in the name, EM. I love the stimulator. I use those in person when I do in-person sessions, but remotely, I typically use eye movement. And I use my hand. I don't often use those plugins. I just prefer going old school, which is funny because I'm pretty new school in a lot. I mean, we're on a podcast right now, but I do tend to, because I pull it for this. I move my face out of the frame typically because I've had clients tell me that they want to make eye contact, which obviously breaks the smooth pursuit, the eye movements. So, yeah.
Okay. So let's say, all right, left hand, I need to read this article because I'm going to have this meeting with Jeremy and I want to know what I'm talking about and ask good questions. On the right hand is like, I can't deal with all this academic language.
Yes, the overwhelm. Perfect.
Right.
Okay. And so you're just going to notice kind of which hand you want to follow. Notice if there's any subjective distress in that overwhelms. I'm adding that word, whatever you want to call it, the sense of not wanting to read it. And you just notice, you observe what it is in each hand. And if there's some anxiety in the hand for avoidance that we need to turn into its own protocol or pursue in the protocol we're doing now. So yeah, just we'll do this whole deal here. Just notice. Okay, and what did you observe?
Okay, left one. And it's not, it's like it's in retrospect, right? I obviously read the article and now I know we're having a good conversation thanks to that. But it was a good demo. It was I know that a lot of people are reading the that Robin Shapiro's chapter in EMDR Solutions, the blue one, the first EMDR Solutions. And then not really sure how to do it, so I think that was really helpful. Thank you, Jeremy. So Jeremy, a question I ask every person on the show is, how do EMDR therapists get better at becoming EMDR therapists?
Absolutely. And I loved that question when I got it in the email that you sent out. So you actually asked some 3 core skills needed to deliver treatments, better treatment outcomes. And so we'll dive right in there. So I'm going to say number 1, is going to be patience with clients. So, and with oneself, because as we know from the initial training, with usually 2 weekends, it was for me. Some people get longer basic trainings now, but you learn the protocol in the beginning. You're told to do it typically with clients that fit within that. And then the second weekend, you learn, it's a little more complex sometimes. And then through continuing education, you learn it could be a lot more complex. And here's some ways to implement that. So you've got to recognize you're not going to know everything right away. That's the bad news, I guess. That's the human news. But the good news is that there's always going to be some great supplementary material, like from my mentor, Ariel Schwartz, from Robin Shapiro, of course, from other luminaries in the field. So if we feel overwhelmed, we can take a breath and notice that there's plenty of content out there that we can educate ourselves on, whether it's cultural development or more of the intellectual kind of protocol understanding that we need. So, and that kind of dovetails with a willingness to learn, right? So that's another element that I talked about. So always be ready to continue in that EMDR journey. If you have the fundamentals, which this podcast is a great place for that, of understanding some mechanics, then that's wonderful. You add on top of that and learn to adapt. but you've never completely learned everything there is to know about EMDR as a modality, because it continues to grow. We learn more and more about it as the years go on through research. So, and these are non-hierarchical. So I said that the best place to start is patience, and that's true, because that's an attitude that can help us to learn, to be willing to learn, so that when we learn something, if we don't get it right away, we're not going to just throw our hands up, right? Or if a client doesn't respond, we're not going to think it's us or them. We're going to recognize they may need an adaptation, like we talked about for block processing. So mindfulness is that third element that I'm talking about here. The awareness of what's going on in the moment, that immediacy, if you want to use that synonym, what's happening in the room with a client. And EMDR is a real art and science combined. There's a rhythm to it, just like there is with the Zeigarnik Effect. It's that interruption, exposure, and et cetera, and that biphasic pattern. So that's what I would say. Those elements: mindfulness, willingness to learn, and patience.
Yeah, and I love it, Jeremy. And I love that you started with patience, because I know a lot of therapists coming out of basic EMDR training feel overwhelmed and don't have that patience. And if you don't have it, and if you don't continue to learn, like you said, I don't think I'll ever get to a point that I'll, say, oh, I know everything about EMDR, I have to stop learning. You continue to learn. That's why we have more trainings and conferences and research, and also that combined element of art into the science of EMDR. Jeremy Fox, you do consultations for EMDR therapists. You focus on complex trauma. What else can you provide to EMDR therapists, and where can people find you?
Sure. I provide a lot of guidance on dealing with anxiety, ego state issues, attachment focused EMDR. I just went to a great additional training on that, which was wonderful. And you can find me on Instagram. My name there's Fox Counselor. You can find me on the Clubhouse app, which is like live podcasting. So if I'm on there having a show, then you'll get a notification. If you follow me, you can come listen, or you can, join on stage if we're accepting speakers, and we can talk. I typically have like a panel of physicians and fellow therapists join me. It's a fun time and very informative. I'm discussing communication myths tonight, which this will probably air after that. But so at Fox Therapy is my name on there. You can find me on LinkedIn, Jeremy Fox, EMDR consultant, I believe. Like they can email me as well, foxemdrtherapy@gmail.com. That's a great way to connect, because some of my usernames, I'm not changing them right now, but I may get more of like a unified brand name at some point. So stay tuned for that. But yeah, those are some initial places. I'm on TikTok at TOKPSYCH, or Talk Psych. That's my name on there right now. So yeah, that
sounds good. And I'll link to all where people can find you, all these platforms. I'll link to them below this video. So if people want to connect, they'll know where to find you.
Yeah, I'm excited. I really am happy to spread the word about this mechanism, how I think EMDR works, and the different. Oh, and I can also obviously provide consultation focused on how to implement this, how to do future templates that draw on, in other words, that sense of incompletion, and how to leverage that for positive action in the future. That's a big thing that I'm doing now in my own future templates.
Absolutely. Jeremy Fox, thank you so much for your time.
Awesome. Thank you. It was great to be here.